necessary omoko strike wo Ghana no ebusia emergency press conference akoso health minister Kwabena Minta Akando ene afi deputy finance minister honorable Thomas Nyako Ampem ebusia omo de nsem bi atuga na Kwabena Minta Akando health minister ensem ode atuga no ebi su chema de bi action we krampo no ebema nurses na omoko strike no ebu efu mon kra because of that action na we take it. Sasuna Afia Schwar versus Kennedy Kwaku Agyapong ene afi Kennedy Agyapong the prodigal son Kwaku Annan aka Uganda Nerves ebusuya ageta omonchimonka highway no so matumebo na ma chechire semu masrawa so be share video we na obechire wadwen amam your comment section ho one subscribe ya masrawa so be subscribe to Trends GH on YouTube, Facebook and TikTok bibia Trends GH enche ye bia and a next strike ho essence mebusuya wobaka ya an migigwe into details na eba no eye agenti a nurses no omoko strike some of their demands na ebusia an wokọ monchimonka highway no so dia eliki wo ho ma chesa amanfo bogu be no so permit na wo check some of their demands no kra na ebi wo ho mo a amanfo chemu a adai we dey free na ebusia wo check appendix A na eba no acting allowance na de no podi omo de omo dwedwemu a na mame nkwase okakra ba kwa ye tra manfo bebre na adwen funeral grant ebe no eyie enwe sesema omo say eno so no employee wasa aban etua 2100 Ghana cedis omo any spouse eno so 1400 any child enso 1400 all inclusive chese ni we mu nyina ka hunti ebusua omo cost strike no omo say day trip allowances chief director 245 Ghana cedis per day coordinating director chief executive NAFI HOD almost 210 Ghana cedis per day director 175 Ghana cedis per day any senior staff 145 Ghana cedis per day junior staff 105 Ghana cedis per day ebusuanya no pe ududwom kwase almost say medical subsidy almost say employee spouse and 4 children of 18 years and below to be covered by NHIS payment of 50% of the cost of management of illness not covered by NHIS NAFI where a child is above 18 but below 23 years and still in school he or she shall be covered by the medical scheme. So ebusa enwemo mu demand ne de bebre chese we kura ye kekre bi pa na mabobo no na on this strike and sensem way na health minister honorable Kwabena Minta Akando ebusa omaye mputupuru press conference ebusa ne de omagidwa enwemo mu into details na ochirem nia so a edidi so ebusa strike way ebesi any action a health ministry NAFI government of Ghana omo take ya eba no necessary omoko strike na hwan mu na ebeye adwuma to help the states.
Thank you very much, ladies and gentlemen. The Ministry of Health brings to the attention of the general public the ongoing strike action undertaken by the Ghana Registered Nurses and Midwives Association, born out of the ongoing discussions on the new conditions of service signed in May 2024 and originally scheduled for implementation in July 2024. Upon assuming office, we have, on behalf of government, engaged several times with the GNRMA to explore the best possible avenue to approve and implement the new conditions of service. While expressing our deep regret over the current impasse leading to the strike and the suffering patients enduring, the ministry states emphatically that government appreciates the invaluable contributions of Ghanaian nurses and midwives to the development of the health sector. Government remains committed to the needed engagement that will lead to the approval and implementation of the new conditions of service for nurses and midwives. Accordingly, government has directed the Ministry of Finance and the Fair Wages and Salary Commission to, as a matter of urgency, lead the development of a roadmap to ensure a smooth implementation of the process. We engage the leadership of all Nurses and Midwives Association within the health sector on 30th May 2025 to address their challenges and discuss the subsequent roadmap leading to the implementation of the new conditions of service. Fortunately, the other associations supported my intervention, with the exception of the GRNMA, which declined and proceeded to declare the strike on the 2nd of June 2025, despite the NLC caution. The National Labour Commission on Thursday, 5th June 2025, summoned all stakeholders to an emergency meeting to address the matter. However, the GRNMA failed to attend the meeting. Consequently, the NLC was compelled to take legal steps to declare the strike illegal and called on the GRNMA to immediately call it off in line with law. Yesterday, Monday, 9th June 2025, we invited the Fair Wages and Salary Commission to engage the GRMA, the Ministry of Finance, and the Ministry of Health to deliberate on roadmap for the successful implementation of the new conditions of service. At the meeting, the Fair Wages and Salary Commission once again, in accordance with law, directed the GRNMA to call off the strike to allow negotiations to continue. Government wishes to stress its readiness to further engage with a view to implementing the conditions of service in a manner that does not dislocate the national budget. We wish to draw attention to the fact that the conditions of service under reference are not captured in the 2025 budget and will completely throw the economy off gear if implemented immediately in the manner it currently exists. We are mindful of the serious economic consequences of unbudgeted expenditure and want to avoid the economic slippages that led to the hardship in the recent past. Government commits to continue to engage with the nurses in order to achieve a mutually acceptable outcome in the interest of the public. While working around the clock to resolve the impasse, the Ministry of Health has taken the following steps to mitigate the suffering of Ghanaian patients unduly affected by the strike. The ministry will, in the next few minutes, publish a comprehensive list of facilities to complement facilities where nursing services are lacking and where patients can seek health care. Given the urgency of the situation and suffering of the patients, government appeals to public-spirited retired nurses and midwives to volunteer their services for a brief period pending the resolution of the impasse. We further express our deep appreciation to practicing nurses who have opted to remain at post to help suffering patients and urge others to show similar fellow feeling and assist our ailing compatriots even as efforts are made to address their concerns. In conclusion, government reiterates its commitment to dialogue with the GRMA with a view to resolving this impasse for full nursing services to be restored. Thank you for the opportunity.
Action are taking the say. Some of the facilities are nurses na de be any hono. Omo health ministry no my and say. Retired nurses, any of you retired midwives no omo akwa ahumdwe mu no omo necessary no aban to sra omo a oni omo kasa say omo mbra na no de omo mbesom Ghana for omo mbebo Ghana for nti no health minister busua one of the action ebuso no dey we take you ho. After this and press conference national no ebusia deputy finance minister Honorable Thomas Nyako Ampem ono de ochem say eba no nurses for demand bi ebusia mabobosua a sika ebe kose oman Ghana no
we've all heard the Minister for Health, and from the Ministry of Finance, we want to show our commitment to help in resolving this important issue, because our nurses are very, very critical to healthcare delivery, and we appreciate what they do. But the reality is that we have over 120,000 nurses, and the implementation of the current condition of service that they are demanding will have serious consequences for the budget. In fact, if we fully implement it, we are going to add in excess of 2 billion cedis to the compensation budget. We have all committed that in our resolve to reset the economy of this country, we must maintain a 1.5% primary balance surplus every year in order to bring our debt levels to sustainable levels. And so it is important for us to manage expenditure. And so we want to appeal to our revered nurses that we are willing to negotiate, to sit with them and the Ministry of Health to agree on a roadmap that will help us incorporate what can be accommodated in the budget for next year.
Deputy Finance Minister, Honorable Thomas Nyako Ampim, onu de ochema, eye nurses omu demands omu hear from government no. Saben ye na adwen process or the mo kra na ebusua, ebe cost oman Ghana 2 billion. Wo de kwoti sika ne mo ebusua 20 trillion. Enye sika ketwa. Na eba no eye press conference ebusua omu de hye su ya. Eye Registered Nurses and Midwives Association omo president eye Mrs. Perpetual Ofori Ampofu onu de ochem say if they are telling us today that there is no room within the budget to cater for whatever we deserve as nurses and midwives, then they are telling us that they do not value what we do in the health space. Now, Simon Chimonka Highway no so. Man shall not live by peace alone. Over the weekend, Kennedy Agyapong Kwaku Agyapong, the video ever trended here. Bra Okopiemo Ashanti region, just omiti, party supporters are. Honorable Kennedy Agyapong Kwaku Agyapong, aka Mr. Showdown, Auto firemen any Gumbi, Dr. Mahmoud Bawumia say, oh, what is our man for Dr. Bawumia? Obieni woman, the first attempt, our person obedi president, they was successful. And we know, Saman for say, oh, Dr. Mahmoud Bawumia, almost saying for them they be and the sanet. Number mono, say J. Okufo twice, Nanado Danko Kufado call me and son. John Ivansifi Atamos, former late president, and also call me and Sunday. It means to say, Omejuma Moya Yano, any omu vote in Ebusia, not a costu. Number one, Dr. Bawumia, the first attempt. Just say, we'll lose 2 million votes, dear Debbie. Import baby, our original looking at the Japan or Casa Crampono. When we say, or say, aha, I also name Crampono, I or Moefi Bawumia, not just say, or one up soca. And somewhere Kennedy Agyapong Japan the 2 gallon and the Afia Schwar type was a Debbie Kennedy and some of the 2 gallon. Or person diverting some or bet you ja.
Yeah, introducing D-Levy. Ghana ni be a cassette here. But because Kennedy ko cassette here, Nisika went this for one and Sanka. Yeah, introducing D-Levy. Ghana ni be a sorry a cassette here. Kennedy Agyapong say, the doctor and friend and country and tell no, they won him. What is a Kennedy cassette here, D-Levy? MPP for Shemrasem will be on a campaign. Kennedy a D-Levy not all. A company can summer and no correct at the 2 Mahmoud Bawumia so. Because medical catcher was a Kennedy Agyapong, na agenda no a yabakupe. To set confusion in the NPP so that they will pay him. And you only one agenda and only one. And you only one agenda and only one. They are paying him to distract people. Let the other one distracting. Yes, said you can't be at Tiamu Dilevi, and I know can say, I'd rather force one more demonstration. Kennedy is one day. Na Kennedy in summer or Kayani in Ano, the referee back. But once again, Kennedy will on one the catcher and say, now we'll brain tumor. And to brain tumor, so I've been in a beer so. Once the car engine, ye beer so near Katasua, and yet do what they say. Sana Genete, I didn't ask the car engine. Say ye near beer so. Ye beer so say, now your boss will be a man, and from our firm, and yet the same beer overhauling any manama baby, and yet the same. Because answer, sir. And can walk as a professor do what he call Bakupe. Now was what castle so. Sabawumia, Mimi Kennedy to me back or more my election. Now you know what free. One, I am. You should have a mental problem for you not to be able to process information as it's supposed to be processed.
If you trust nigga one man answer, and no sense say, so the supplement ama Kennedy Agyapong Kwaku Agyapong there, and the Kennedy Agyapong Kwaku Agyapong, and the prodigal son Kwaku Annan, you got the nerves, or no so message mano. Kwaku Annan na eba no fuel levy, who essence someone. onu de o chem say wate ensama NPP for kan ayibuso ba ka ya Kwaku Annan obo so parliament ni gumbe say NPP omu ni right bia say omu ba ka setia eye dumso levy ana say fuel levy ho ensensem enu ti Dr. Bawumia Krampo a odi nsem bi betu dwa on that fuel levy ni Krampo o say o
Bawumia kwakosi dam the Pwalugu dam we dimu saying $12 million obi anka hwe nkyere no Pwalugu dam na amba. Meanwhile, the Pwalugu Dam must serve as a multi-purpose dam. On one chrome, wale with the Ghana, bro. Today, my goodness, Bawumia Wokasa, you better shut up, eh? Bawumia, you got that nerve. You got the effrontery, that prowess. Woo, Bekasa. Now let me tell the MPP for MPP. And you want to say Bekasa fast attacks you. Shut up. Shut up. And you want to say Mokasa. Leave that to we Ghanaians. Mayan Kasa. Yeah, penny people mama kasachi and this if I am MPP for. Shut your mouth. Now come on into him. You are too dirty enough. And I'm a chrome for we would dip for a recap for the mutrimo day a summon ashamoma bonnet and ashamoma munyenipa. Sansi Kanwam. Aya Osla na Joma ma create answer walk on and musica way mo me country Ghana for NDC for tell Ghanaians MPP for say scanina wo be di musica ina chese wo ho ade o di sika ye sika die e medie man so crazy mutimi ni wom hanem ni ade tibo de eden. What do you do with our money? What do you do with our money? Esum ayo memu sika abeifo enkabrecho hofo adamonifo na mutio mem okoto fo ho am Emojanom for and a Museyo me.
Kwaku Annan aka You Got the Nerves, aka Kennedy Japan, the prodigal son, and some way only two Gano, and no the Afia Schwar nigga which him say. Our message, Emma Kwaku Annan aka Read My Lips.
Bawumia Kwaku sit down. The Pwalugu dam we did say $12 million Obia carry.
Ghana for moon screen record we na monkoye Pwalugu dam enye Bawumia na me. And I'm in Sabako, made them in Sabia new beat in the chest. Kwaku Annan, up a Sawya, who Sawya and Santroni, but Kwaku Annan, one and Santroni. Kwaku Annan, oh yeah, Canada, Japan, boy, I know do Jimmy. And because all we do with idiots is to use and dump them. You were use and dump. Me pacho Pwalugu dam, a public document, someone call such a Dr. Akoto. And I have Pwalugu Dam. Dr. Akoto, former Greek minister. And I have Pwalugu Dam. Boy, you see Pwalugu Dam. Our budget na 40 million or boy. Pwalugu Dam was constructed by that Greek ministry. May they sure say Bawumia a year Juma wa Greek ministry. Sikano na 12 million. I think 12 million students. 12 million, and this is for by a tier. Mom or be for be an eye for, and this is for the Mahama by power. Almost for be an eye for, Musa be an eye for, say. Almost invited Dr. Akoto over some 1 million beer now a month. I am giving you security information right now. Don't open your mouth to clear all doubts because Kwaku Annan Ghana yen nani so waji. Pwalugu dam Dr. Akoto a Greek ministry for a projects. And this by a BNI invited Dr. Akoto over 1 million be a omontiasie. The reason why woke ordinary Ghanaian wanting and they say or choir no coach 1 million mu actually woman. I don't think sir Mamudu Bawumia or yeah Duma wa Greek ministry. Most importantly, they are not business partners. And say yeah and our Greek ministry project contracts. Now you ufumpu say kwasia etwapino. Uji mi say they do ye projemo. Kwasia dem me wan na Shawanim. Diabetes nejeja wanim sa no ko pedro no wa. Hey. Wo bo Dr. Mahmoud Bawumia di bi ma o. Wo bo Dr. Mahmoud Bawumia di mo bi ma. Woni ne wo sen kwasiafo na. O ma tia wa ma jimi amfiri wani no. Wo kwasia ba kwa gym no. wo ba ko gym na wo wuru no wo bo Dr. Mahmoud ba wo bi di bi ma ho maka to me say today I'm in a good mood. What's na Kennedy Agyapong TV station a blackmail a software wo Ghana ninara e ma Ghana software ninara e be time NPP wo de baba wo mi aso wo kwasia wate wo abusuam de wako school ne o wo so kwa when you read you don't understand. When you read documents you don't understand. Because if you can read to understand, oh my baba will be able to palu down. Tie dem make a chono. What do I know? Tie dem make a chono. Jimmy Abro sono. Tie dem make a chono. One no ma peteshi. Aduano. When him sa kwasia wate. We are kwasia na we sa kwasia. Onyame ahaw. And when I'm akukura ni wani mo kwakwana. You are not just stupid, you also look stupid. It is so sad. You are not just stupid, you also look stupid. Oh, we are no one purple shirt, abo yellow watch. Now with the Jimmy no, quite chimame wa. Wokwasi, I want to catch us say a purple shirt, and the yellow watch. And then John Mahama no free gonja no, one also about yellow watch. John Mahama kwa free gonja. Why tell bano? One saw boy yellow watch. What Jimmy Wunya Santinia than for home? Wunya Santinia than for home. A poor power for them Kurumo. One saw boy yellow watch. Now we
Afia Schwar, aka Sister Schwar, aka Patakwajakum, and some way no they are between from him about Kennedy Agyapong Kwaku Agyapong, any of the prodigal son, Kwaku Annan, aka Read My Lips, aka You Got the Nerves, aka I Swear to God. A health minister, honorable Kobene Minta Kano di Ochimwa. Nurses omo strike no, wasra omo asa omombra back to negotiation table no. Nempempre omo kese pa de. Midwives ene nurses a omo ko retirement no. Omo ene sesi ado mu hi omo mbo nti aban ene omo kasa se. Omo de omombra obi mpo obi pe. Ebusia, share wa dwuma me comment section ho. Na share video we ba foforo so ensa enkebi. Makra.